painful. I need you to help me. So I want you to bend this way, like there it is.
I'm a giver. I love to give to my family, give to my friends, and I just don't put myself first, and I've really let myself go, and I think it's just more of a disappointment within myself, not making myself a priority,
But I want you to place more weight into today, right? Because this is the first time you decided to take control of everything.
Yes.
And I think that's huge. And I don't think people realize how big of a step it is to say, I'm going to take care of myself and not put others first, and I'm going to put myself first today. Be happy, be proud of yourself that you decided to say, I'm doing this today.
Right.
This is our first chiropractic visit ever.
Yes, correct.
Scale from 0 to 10, how nervous are you?
10. 10. Yes.
So the camera helps even more so, right? Well, thank you for coming. Tell me what brings you in, what's bothering you? I know we were talking a little bit about it earlier, but what's the final straw for you?
Just right now, I've realized recently my back has just been really getting stiff. My hips, my left hip has really been bothering me. Just walking for like a long period of time, my back stiffens up. So I kind of noticed it a lot when we went to Disneyland, and it's not comfortable. It's, it's making me walk a lot slower, just not to be able to function, to be able to twist, to move. I'm having a really hard time not being able to do normal functions.
Yeah.
So
how long has this been going on for now?
It's been going on for a while, but I'd say I've noticed it more within the past year to 2 years. And I think too, just during the pandemic, with a lot of stress, a lot of inactivity, hasn't helped. The weight gain as well, it all hasn't helped.
Right. And I think that's really where the rubber meets the road for a lot of people. So whenever you're coming in or anyone else is coming in, it's not the pain per se, it's the fact that now it's limiting you on things that you should be able to do. And this is where we want to get you back, right, to help your body out. Now, I think the reason why we take x-rays here too is so that you can see internally the progression of what's happened with you, because it seems like this has been going on for close to 5 years now. Yeah?
Yes.
Okay. So it going on for that long doesn't mean that it's only been going on for 5 years. It means that it may have been also starting a little bit earlier and then starting to work its way back.
Right.
Have you gone through any slips, falls, any big accidents, anything like that?
No, I've had car accidents, probably 10, 15, 20 years ago, but nothing major, no injuries from that. I did one time feel like I kind of possibly threw my back out. I, deal with sciatica at times. I went to the doctor and he said no, it's fine. But I'm like, no, something doesn't feel right. And, and I just I was able to function, so I just kind of kept going, moving forward.
So you've heard some advice that hasn't been quite right, right? And it seems you were talking about sciatica. So let me just do this. So neck pain, yes or
yes.
no? Headaches, migraines?
Yes.
Okay.
Not daily, but I do get them.
How often a week?
Maybe once a week. With stress, they just become a lot more. Migraines will hit every, 3 months or so. Yeah. But the headaches, I do get them weekly.
Do you know what number of is for normal is per year?
For me or just in general?
Normal in general.
It's probably 0. You probably shouldn't be getting any migraines,
maybe like 2 to 5. 2 to 5 is normal. Okay. All right. So we have headaches, we have migraines, we have neck pain. Do you have any numbness or tingling too?
Sometimes if I'm sitting for a long period of time, I might feel tingling or numbness in my arms or my legs, but nothing where it's just from sitting there.
But that's not normal, right?
Yes.
Yeah. Yeah. But lower back pain too, sciatica pain too, feet pain too.
I'm starting to notice my ankle, it's been a little bit more tender. I just feel like I've had issues on the left side, of my body. But yeah, at times, like I said, I know arthritis runs in my family, so I'm sure, I'm probably. It's genetic,
Well, I think genetic-wise, right, and I tell everybody this, genetic does have a role, but just because it's in your genes doesn't mean you should get it. Genetics loads a gun, but it's up to you to fire it. So it all begins to really boil down to what do you do to prevent what you know. Arthritis isn't something it's a normal part of life, but it also, the severity of it doesn't have to be normal. But if you do the same things that your mom did, you do the same things that your dad did, and you're going to end up the same way. Right. Like heart attacks, I've had 2 uncles already die from a heart attack, and they lived till they were 60. My mom is already close to 80, has no heart issues.
Right.
What's the difference? It's because she didn't eat the same thing. She exercised more, and one was actually a heart surgeon, right? So she didn't do the same thing. So it really comes up to you, what you do with your body and what you do with your life. It's really going to impact the genetics, right? But there is a few things that we're seeing in your body now. How do you feel like everything has impacted your life? Like, what's the worst things that you've seen now?
I think the worst I've seen is just the lack of mobility. You know, the simple tasks of, you know, bending down, you know, tying your shoes, you know, I have to put my foot up to help tie my shoes, things of that nature, because I'm just stiff. My back is just stiff. My hip hurts. So walking for longevity, you know, period of time, it's just my hip backs up.
It's brutal, I will also have to adjust shoes at some point too, right? Now we always want to show you what normal looks like, and we want to show you what yours looks like.
Right.
That's why we take the x-rays here. So come over here this way. So when we look at yours, what do you notice about yours?
Yeah, very crooked.
It's very crooked. So when you look at this neck on the right side and you look at yours, what do you notice? First, curvature wise, what do you notice about the curve?
Basically, there is no curve. I mean, it's kind of like straight up and down in the sense. I mean, it's leaning a little bit, but...
What do you think after seeing all that?
It's a little scary, you know, just that I've let it go for so long, you know. And, you know, just not putting myself first, you know, priority-wise. You know, I always take care of everybody else, you know, and just, I'll deal with me later, you know, and that's just, you know, I'm here to take care of myself, you know, finally put myself, you know, priority. It's just, it's a lot to see and take in.
It is,
you know?
It is. But you know what, no more, right?
Yeah,
no more. You have to put yourself, because here's the thing, if you're not good for yourself, you're not good to anyone else.
Exactly.
Okay? So I'm here to help you. I'm here to
appreciate that.
Get you relief. I'm here to give you the best tools necessary. We need to fix this.
Yes, definitely.
If it gives you any solace, right, you are no better time than the present.
Right.
You're actually doing something about it now. There are some people that wait another 5 years, another 10 years, and it becomes even more worse than it is now.
Right.
And it becomes almost irresolvable.
Right.
Is that a word? I don't know. Unfixable. Okay. So, you know, you're coming in. I'm sure it's a little bit more time than you should have, but we still have some things we can do.
Right.
So let's do a few checks.
Okay.
All right. I'm going to pull this back. Now, look straight to Sophia.
Okay.
Turn your head to the right a little bit. Now, when you do that, does that hurt?
I can feel like a pull in my back.
Okay.
And I won't say it hurts, but it's not comfortable.
So stay there. What I want you to notice is that your nose is like this, and ideally it should be back here. So you're right around like 50 degrees, and we want it to be closer to 90. Okay. Look to the left. This one's a little worse, right? So you're like at 45 degrees, and it should be this way. Do you have neck pain today?
Yeah, on this left side.
Do you have a headache today?
I feel like it's kind of like traveling up. Like I've heard on some, or I've seen on some of your videos, people feel like, oh, I can see better now, and I feel like lately it's just, I don't know if that affects your eyes, you know, or not. But like I feel like the past couple of weeks, I've been kind of having some issues with my eye, so I don't know if that's pinched nerve, you know, if it has anything to do with it or not.
So we want to see clear today. Let's have you look all the way up to the ceiling. Good. Is there pain at all when you do that?
Same thing, just uncomfortable. Okay. You know, I could feel like pressure.
Yeah. And then look down for me too. Any pain when you do that?
Not as much as when I look up, but yeah, just not comfortable.
Stand up now for me too. And move forward a tad, just a small bit. Try and touch your toes now for me. Does that hurt your back when you do that?
It's just, I feel like stuck, like I can't go anymore. But yeah, just uncomfortable.
Does it hurt too?
A little bit of pain, not a lot of pain. And maybe I've just gotten used to it, you know? It's become my normal, you know? Like it's probably painful, you know, in the past, but I've just got accustomed to it.
I got you.
You know?
Yeah, and it happens, right? And here's the thing, just because it's normal for you doesn't mean it's
supposed to be, right?
I'm gonna have you drop down to the right side.
Okay.
That way. Any pain when you do that?
Yeah, pain in my hip.
Okay, and then do the other side.
Oh yeah.
Okay, so that's even worse. Okay, have a seat here. I'm gonna grab my activator. So I'm gonna feel in through this area. So you feel how tight everything is here. So this is not gonna feel the greatest, but there is a rib that's right here that I'm gonna press down into. And what we're trying to do is get that to feel a little bit better. Trying to get some more motion around there. Awesome. And then right in through here also. Ready?
Okay.
Feels good?
Yes.
Are you lying to me?
Well, it's very deep. I can feel it.
Look straight. Turn your head to the right again. How does that feel?
A little bit less.
A little better? Yeah. And
Yeah.
look to the left. Yeah. That's a lot better.
A lot better. Yes, definitely.
Let's have you go face down into the table. So I want you to keep the left leg straight and then lift it up as high as you can. Good. Any pain when you do that?
A little bit, yeah, in the, like, feel it actually in my knee a lot.
Interesting. And do the right side. Any pain there?
Don't feel as much pain, but it's just, I can't lift it very high.
Gotcha. There's just been so much pressure that's been built up here.
I rate it.
So we're gonna do what your body gives us, but I can feel this part already loosening up. So just like that.
Okay.
Placing our hands right here, I'm pushing just like this. So we're doing something with these ribs a little bit. Pushing those in again.
Yep.
Good. Now lift the left leg all the way up again. Yeah, ballerina. And the right side. Yeah.
Yeah.
How are we feeling?
Wait, 1000% better.
Good. We love it.
Yes.
Let's do this. Let's have you stand up now again for me too. Let's walk around a little bit, see how everything is.
Oh yeah, I feel like even just walking is feeling better. Even with my hip, when I would walk, it would bother me. So yeah.
This is good. This is very good.
Yeah, yes, definitely.
All right. So what we want you to do now is you're going to sit at the edge.
Okay.
Right here. So we want to get some movement in the areas that we can. So let me take this arm like this. Let me see the other one underneath. That's good.
Okay.
And head down and slouch for me. No, slouch. There you go. Good. So right in here, lay all the way back. Keep your head tucked. Now lay all the way back. Drop down. Deep breath in for me. Exhale. Head down. All the way. Oh, there you go. There you go. You can lay down there.
Oh, God. Wasn't expecting that.
No. How did that feel?
Felt great. Yeah, just a big release.
Yeah, that was huge.
Yes, definitely.
Now, let's have you sit up. All right, let's do it to it. Okay. So we want to see how everything just kind of moves and shifts.
Okay.
So I'm going to see this way, yep. That way, so this way is like, yeah, actually harder this side, huh?
Yeah, a little bit.
Yeah. Let's have you look down for me too, and then turn your head to the right, turn your head to the left. Yeah, not moving to that left side, huh?
No, left side's
just wonky.
Yes.
Look straight again for me. Yeah, okay. So we are gonna push this atlas that's really happening on this left side here. I'm gonna go like that, right? Just like a baby.
All right.
So lean back here, and I'm gonna let your head relax more. Good, lean on me. No, not your head, but your back. There you go. And loosen just like a bobblehead. Good, okay. So we're placing my hand just right here. That's great. Let your head turn to the right. Good. So we call it lateral flexion, and we need to get all the way over.
Oh my God. You know, watching all the videos never prepares you for that. Wow.
That was huge.
Yes, definitely. Yeah. Now I know why people say they can see better. Wow.
So you were having that fogginess earlier, right?
Yes.
How are you feeling right now?
Amazing.
Good. That was a lot.
Yes.
Let's have you scoot to the right now for me too. Lean back on my leg. So I just want to see something here. Let's relax. Good. Loosen. Have to pull. Oh, it's not going. That's okay. So your occiput is just like jammed. Lean back on me. All right. Relax your head. Hard for you to relax a little bit?
Yeah. Not my
Not your strong suit?
Not my strong suit.
Well, you did good last time. So you see how like when I do this, it's kind of painful? Like I need you to help me. Okay. So I want you to bend this way. Like there it is.
Oh, wow.
Oh, yeah.
Yeah, I felt that one in the back of my neck. Yeah. Yeah. Okay.
How are you feeling?
Good. I mean, just that release, you know. I mean, I think just over the years, just everything builds up,
Yeah.
you know, just to let it all go, you know, and I have a really hard time with that.
No, I know.
So I'm trying to work on just letting things go and letting things be, you know.
And it seems like your body, like right now, like you don't have to hold it in. It's okay. Like I can see, like there's been a lot of things that you've been holding in.
Right.
What's making you emotional?
Just like I said, you know, I'm a giver. I love to give to my family, give to my friends, you know, and I just don't put myself first, you know, and I've really let myself go, and I think it's just more of a disappointment within myself, you know, not making myself a priority, you know. I know the familiar, you know, saying of you gotta take care of yourself to take care of everybody else, and, you know, I guess I just thought I was, but, you know.
Yeah.
Just, yeah.
No, I get it, and I think, but I want you to place more weight into today, right? Because this is the first time you decided to take control of everything.
Yes.
And I think that's huge. And I don't think people realize how big of a step it is to say, I'm going to take care of myself and not put others first, and I'm going to put myself first today. That's a huge step.
Yeah.
Right? And so take more weight into that.
Yeah.
I think out of anything that happens today, right? Be happy, be proud of yourself that you decided to say, I'm doing this today.
Right.
I
appreciate
because
that.
this is why you're here, right? And this is why we're trying to help you, because you gotta be good, and we want you to keep going to Disneyland.
Yeah, right.
Did you get those seasonal passes?
You know what I did? They're expiring at, I don't know, that price tag.
Yeah. We just got some, and my wife told me the price. I was like, wow.
Right?
That is not cheap. Okay. Let's have you lay on your back now, though. So we are going to be pulling on you. Okay. All right. You ready?
Yes.
Ready as you'll ever be.
As ready as I'll be.
Lift your head up for me. Keep it up. And down. Good. So we're going to place this around your chin just like this. Okay. So you're going to feel me grab really tight on that right side. Okay. The only reason why I'm doing that is because I'm injured. Okay. My arm is injured. Sophia hit me one day. Uh-oh. And she was like, I don't like you. That's why we're firing her tomorrow. So tilt your chin up a little bit. Good. And you're going to keep your lips and your teeth together, okay? Is this too tight on your throat? No. Okay. So what I want you to do is keep your chin down a little bit, though. That's better. Okay. So nice and easy. We're just going to stretch you out a little bit first. You all right? Deep breath in. Keep your lips and teeth together, but out through your nose. Yeah, so I really want you to be able to release this. So the better you relax, the better your body will take this, and you'll feel a lot more, just better release, just in general.
Oh, good. Oh, wow. Was not ready for that.
No.
Yeah.
Take your time.
Like everybody else said, it wasn't going to cry. But yeah, no, it's just letting it all out.
Let it out. That's a part of it. This is you. Part of it's healing, right?
Yeah, definitely.
This is it. I did this to my mom, and she had the same reaction. Freaked me out. Didn't know what was going on. Yeah. But it's just a lot, right? You deal with your family. You take on your family's stresses and their burdens, and you take on your own. And
yeah, definitely.
This is good. Take as much time as you need, okay?
I definitely needed that for a long time now. You know, I watched your videos, and I think you have a gift, you know, and that's why we're here today too, because I think that, you know, there's just some people who have gifts, and I think, you know, you have that, and that's, you know, I wanted to experience that.
Yeah.
You know, so thank you. I appreciate it.
Well, I appreciate you trusting me and doing all of this, because it takes a lot for somebody to come, especially if you've never been adjusted before. It's the toughest thing.
Yeah.
To be like, okay, I'll let you pull on yanking my neck.
Yeah. No, I was really nervous, really scared, and my son, it's like, Mom, you need to go do it, and it's just one of those things, yeah, I'll do it. And, it's the uncomfortableness, the pain was just becoming too much. So it's like I needed to listen to, him and my body, because I've been ignoring it obviously for a long time.
I think it's also hard to listen to your son, right?
That too. He can't know more. He can't know better than me.
No, well, he never will. He might be right on some things, but never more. How are we doing?
Good, great. Yeah.
Awesome.
Just that's amazing. Yeah.
It's nice to have some relief, right?
Yeah, definitely. Yeah, definitely.
You ready?
Ready.
So look straight, and then I want you to look at that.
Yeah.
Sitting up so straight. Okay.
Yeah.
Let's have you look to the right now for me.
Oh yeah.
That's phenomenal. Look to the left. Oh yeah.
Yeah.
Let's have you look all the way up to the ceiling. Beautiful. And look down. Yeah. Stand up now too. Try and touch the toes for me. All right, how do we feel?
Yeah, a lot better. I mean, I'm getting there closer. It's going to obviously take a little bit.
Is there any pain when you're going down?
Oh, no pain. No pain in the hip. No pain whatsoever. Yeah.
That's amazing.
It's amazing. Yeah. It's amazing.
Go behind there for me. And then, okay. I want you to drop down to the right side.
Oh, yeah.
Better.
That pain.
Left side. Oh, wow, that's so good.
Yeah, so, I mean, it was painful just to even move, but yeah, so much better.
It's nice, right?
Yeah.
So your body, right? So what I want you to start doing is you're going to start walking backwards about 10-15 minutes every day.
Okay.
There are some shoes that we recommend, because here's the thing: when you're walking long periods of time, what you need are some flatter shoes with wider toe boxes. The ones that you have right now, they're too narrow, so it's going to hurt your back. Use these when you go to Disneyland, whenever you're walking for long periods of times. They're called Flux, F-L-U-X.
Okay.
We'll give you the link before you go.
Okay.
And then just grab that pair.
Okay.
I'm telling you, game changer.
Okay.
All right? So tell me how you feel compared to when you first walked in.
It's just amazing, like, the release, I feel so much better. Just feel lighter, just, like a big release, It's just kind of hard to explain, I don't know why I waited so long, I was just fearful. I was scared,
Yeah.
But, there was nothing to be afraid of,
Of course not.
So.
That's good. I'm happy. So neck pain right now?
No neck pain, no pain anywhere,
Let's go.
Yeah, let's go.
That's so good. Well, thank you so much.
No, thank you so much. I appreciate it. No, thank you.
Good.
Thank you so much.
Love it. I'm so happy for you.
Thank you so much.